everyone knows that more people died in World War I from influenza than from the actual battles, which were very, very bloody.
I think this latest outbreak is really telling on the fact that humans live with infectious pathogens day in, day out.
You're listening to IDViewPoints from the Janssen Pharmaceutical Companies of Johnson & Johnson. I'm Angela Giovine. You're likely listening to this podcast from home or in some level of quarantine today, as we all practice physical distancing to help flatten the curve in response to the ongoing COVID-19 pandemic. But let's go back beyond coronavirus to talk about epidemics, a word that has shaped history and science alike. We'll chat with Dr. James Merson, the Global Therapeutic Area Head for Infectious Disease at Janssen, and Dr. Thomas Fekete, a physician and professor at Temple University. The history of the world has been shaped many times over by infectious diseases and the impact they've had on society. We now know this firsthand, as our lives have changed day to day in dramatic ways since COVID-19 began. Dr. Fekete, which diseases do you think have played a major role in shaping global history?
I have a very great passion for infectious diseases. I've been doing it for 40 years now, and it's impressive to me both how it affects individual people, but also populations. And I have to remind you that every once in a while we have outbreaks of things, whether it's from a local food that gives us a bunch of diarrheal diseases or perhaps respiratory infections. But this goes way, way back. It certainly goes back into antiquity. And we know there have been outbreaks of things like smallpox that have been going on for literally thousands of years. Of course, smallpox has now been eradicated, and that's wonderful news for all of us. But even in the 20th century, there were literally tens of millions, if not hundreds of millions of people dying from smallpox alone. That's an example of a disease that we were very terrified of and now is gone. When I was a kid, I remember particularly being told I can't go to the swimming pool in the summertime because of the polio outbreaks. You don't say that to your kids now because we're not worried about polio in the US. In fact, most parts of the world are polio free. But I remember that a very specific memory of polio. And certainly we know that when the Europeans came to the New World, one of the greatest tools they had in their toolkit for taking over was the diseases to which they had some immunity and the Native Americans did not. So clearly it had tremendous impact in world history. It certainly had impact on the colonial era. And everyone knows that more people died in World War I from influenza than from the actual battles, which were very, very bloody.
What about U.S. history?
Well, certainly in recent memory, remember the outbreak we had of the variant influenza that started off probably in Mexico, but kind of swept the country in springtime, which is not our usual flu season. That was disruptive in ways that we can relate to because we might have had experiences in our own communities of things being closed, people being sick, unable to work. And that's a very practical sort of modern day example. The one that we all know about that's been huge has been HIV. That was diagnosed in the US first in the 1970s. We didn't have a name for it until the 1980s. And of course, that's affected millions of people and resulted in quite a lot of deaths and a lot of disruption. And luckily now we do have better treatments for it, so it's not quite as devastating. And then even more recently, we know that we have problems with hepatitis C virus, which has been circulating for quite a long time. And now, thank goodness, we have treatments for that as well. But if you go further back, we had terrible outbreaks of many, many things that would be considered infectious when there's disruptions, including things like cholera and typhoid and whatnot. Because those things don't exist in the country right now, we forget about them, but they were definitely instrumental in U.S. history.
The new coronavirus, now termed SARS-CoV-2, we need to take seriously. At this time, we don't know whether it's going to embed itself in the human population or whether it's going to burn itself out like we saw with SARS back in the early 2000s. The coronaviruses are a very large family and they infect many different animal species. And on occasion, they're also able to infect and replicate in humans as well, as we are now seeing with this new virus. But when the virus takes hold and the individual's immune system is unable to combat the virus, then these folks do have pretty serious disease. So I do think that the coronaviruses are going to continue to pose a threat in the future, simply because it is such a large family of viruses, and because there's always the risk that they will jump from their natural host species into humans as we live closely with animals. So I think as we think about the future, we will need to do a better job in preparing how to manage and prevent future infections going forward.
Wow. As we all feel somewhat blindsided by the current pandemic, it's unbelievable to realize that some of these things were just not that far in the distant past, and how much things change from day to day in the world of infectious disease. Which of these infectious diseases have been contained or eradicated?
Well, the eradicated list is a very short one, and I'll start with that. As I mentioned, smallpox was eradicated after a really fantastic effort that started in the 1960s, and finally it was eradicated in 1977. And there was only one case since then, which was a laboratory-acquired case that was very tragic. We now again have a smallpox vaccine because there's fear that smallpox might be reintroduced as a hostile act, as a germ warfare thing. So again, we're not 100% sure that it will be gone forever, but natural smallpox is gone. There's an animal disease called rinderpest that's been eradicated that doesn't affect human beings. And 2 of the 3 strains of polio have been eradicated, leaving only 1 left. And that, of course, has been the source of a lot of frustration because it's difficult to get people in some parts of the world to take polio vaccines, and that's resulted in ongoing transmission of polio. In the US, and people may remember this from history books, yellow fever was a big problem. In fact, one reason why Philadelphia is not the capital is that yellow fever outbreaks were sweeping through this area between the Revolutionary War and the time we decided on the capital. We know that was caused by mosquitoes that were coming in on ships from the Caribbean and other warm climates. That, of course, no longer is happening in the US. There are other things that were common here. People may not know this, that malaria was actually fairly common in even the northern part of the US. That's been eradicated. And then other things that have come and gone include things like cholera, dengue, and so on. There are still occasional episodes, people may not know this, of plague that happen in the US. Those mostly happen in the mountain states, Arizona, New Mexico, and so on. And it's through animals that are in the wild that have the fleas that sometimes come into contact with people. So it's pretty rare, but we do see occasional plague even in the US.
As Tom indicated, smallpox was eradicated in the US as a result of a tremendous vaccine effort. But vaccines continue to have an unparalleled impact on public health and continue to save really millions of lives each year, 2 to 3 million lives a year. And certainly an additional 1.5 million deaths could be avoided if global vaccination coverage was to improve. So there's no doubt that vaccination is an extraordinary set of achievements over the years that has improved public health. But then I don't think we should forget about the medicines as well. Antibiotics, penicillin, being first used in the late 1920s. And it's been estimated between 200 and 800 million lives have been saved since that discovery. And yet today we take antibiotics almost for granted. And yet we continue to see a rise of what we call multi-drug resistant bacteria because of the very broad utilization of antibiotics. We mentioned earlier HIV arriving in the US in the 1970s, and now after many years of extraordinary efforts in the pharmaceutical and the biotech industry have come up with treatments for HIV, such that now people really are on lifelong therapy and no longer are consigned to a death sentence. And then hepatitis C virus. Now we have a cure for hepatitis C, which is nearly 100% efficacy. Certainly the pharmaceutical industry can continue and strives to generate medicines which can just improve human health suffering from infectious diseases.
What lasting effects have they had on regions or communities?
I think of HIV as a disease that affected communities, especially urban communities on the coasts, as a lot of people were getting ill and dying. This certainly was true in New York and San Francisco and Los Angeles, but I think we now know this has affected the entire country, and it's probably the biggest problem is in the South, where People may not live in such large cities, but they carry this disease with its stigma, and their communities may or may not accept them, and that may be a source of rejection for people, which is very tragic in the 21st century.
Absolutely. In infectious disease, more than many other areas, you have to really consider the way the people start to have that panic. And then it sort of dissipates, and you don't always hear the end of the story where it's cured and prevented through various means. Dr. Merson, do you have anything to add on the lasting effects?
Yeah, I'd like to just follow up on the people aspect of this, because globally, the population is growing and it's also aging. Aging brings some challenges because as one gets older, one's immune system starts to become less effective. And we certainly see elderly patients being at greater risk for a number of infectious diseases, particularly influenza and other respiratory diseases, whether it be bacterial or viral infections. Also, the increasing globalization and travel of the human population and the development of megacities continues to increase the risk to humanity for the current infectious diseases. As we heard, 1918 caused an enormous influenza pandemic, around 50 million people killed, more than those killed in World War I. And despite the advent of influenza vaccines and antiviral medicines to manage the disease, we still experience globally around 650,000 deaths a year. So these diseases are not going away. HIV, whereas we think we have it pretty well managed, since its discovery, we think probably 36, 37 million people globally are infected in 2017 with the virus. And it's predicted that we'll see a 14% increase in the HIV population in the G7 countries between 2017 and 27. And that's despite antiviral treatments we have. So people, humans, and the populations, unfortunately, continue to be completely joined at the hip with infectious diseases. And each time we think we're getting on top of them, we find that we're not. And so the medical need continues. And therefore, we continue in the industry to see how we can better manage these diseases.
Dr. Merson, how do you think recent medical advancements have changed the state of infectious diseases?
The pharmaceutical industry have doubled down on generating vaccines for Ebola, and they're being deployed right now. HIV, again, is an extraordinary achievement coming out of Africa and then spreading globally. And yet the pharmaceutical industry lent into that challenge and has come up with treatments. The vaccination piece, though, continues to be an area that we focus on. We recognize, as do healthcare workers and governments, vaccination really is the most effective way of managing and preventing disease.
That seems to be only that much more evident with how we're addressing the COVID-19 outbreak.
I think it's hard to imagine how we would have handled this 10 years ago or 20 years ago, because we do have the benefit of a lot of great medical advances. Having said that, we're beginning to see some of the weaknesses of our system because we have to deploy these things extremely quickly, and that has been a stress. So, for example, the diagnostic tests looking for this virus depend on samples taken from patients that are processed normally in less than a day. But because the backlog has been so long, people have had to wait 5 or 6 or 7 days, which is naturally extremely upsetting. We also have a shortage of test kits. So again, the advancements are great, but you have to deploy them effectively to take full advantage.
So it's here to stay for a while, isn't it?
We think so. At this time, the infection rate, unfortunately, continues to progress at a significant rate. And so it does pose a serious risk. But whether this virus will become a seasonal respiratory infection like influenza or like respiratory virus remains to be determined. But I think what is clear, because the virus has been spreading so quickly, is because there is no natural immunity against this virus in the human population at this time. And so does that mean the virus can embed itself, or, as I say, it will burn itself out? That is, that people generate good immunity to it. So going forward at this time, I think for the immediate future, yes, the virus is with us, but whether it will continue to be with us in subsequent respiratory seasons, that remains to be determined.
I don't know how many folks are going to get infected. It may be 5%, 25%, 50% of the people. But at some point, there will be so few people who are likely to become infected, the virus may just settle down. That would be the great news that I would look for. Of course, there could be another wave or two. It's hard to predict. However, if this virus behaves a bit more like the influenza viruses and changes in some major way, or if immunity is not as durable as we hope it is, it could be here to stay.
Between this most recent coronavirus outbreak and some of the other things that have happened in recent history, has this emphasized the need for pandemic preparedness?
Well, that's the easiest question of all, because I think we've learned a lot about pandemic preparedness that we could never have done from a dry simulation. Some of it is valuable, useful the next time. Some of it will probably not be relevant in 5 or 10 or 15 or 20 years. What we have learned is we have to really prepare in a way that doesn't seem necessarily credible, because when the time comes, you may not have a lot of time to do it. For example, we know that our supply chain is vulnerable, and if we have extraordinary needs, we may not be able to ramp up our production. This is especially a problem if other parts of the world that are high producers, like the Asian countries, are either unable to produce or unable to export. I think we've learned a good lesson there. We also probably should learn the lesson of making the workforce flexible and able to handle many things, because we're doing that every day, and it's been stressful for our workforce to have to do things that are unfamiliar. So probably some preparation, some practice would be a great idea. I think those would be the lessons I would take for the next pandemic.
I think this has been a bit of a wake-up call to the world, but particularly the pharmaceutical industry and the biotechs supporting it. Certainly, governments, as can be expected, are very concerned about this and are actively working with the pharmaceutical industry to work out how we can be better prepared for the future. So what this has meant has been an extraordinary amount of hard work by a large number of companies working with governments to work forward in designing new vaccines that will prevent future infections. But we're also looking at our extensive compounds in our compound libraries to find antiviral compounds that would work against this virus. And so many companies are coming together and putting their compounds into what we call in vitro testing, that is cell-free or cellular-based assays, to determine whether we already have compounds in our files that exert antiviral activity. And if they do, then we will take them to a stage where we can evaluate them in humans for safety and the dosing frequency that we would need to treat the virus. If this particular outbreak burns itself out, those compounds will then have been verified that they work against this strain of coronavirus and perhaps others like MERS and SARS. And then, given that they have been shown to be safe, they'll be ready and waiting for the next coronavirus outbreak.
So basically, the pharmaceutical industry is using the library of vaccines, technologies, and antivirals that already exist in order to get ahead of the process and find solutions for coronavirus.
Exactly, because there's been significant morbidity and mortality originating from this virus. And frankly, we really don't know at this time where it's going to go. We know we can develop antiviral drugs, as we have done against many different viruses. We know we can generate highly protective vaccines against a variety of different viruses. So I think it's an extraordinary effort and really quite humbling, actually, to see how many people from different organizations can come together and start to deal with this imposed threat to the human population. So it's good to see how good humans can be when they need to be.
Finally, what message about infectious diseases and vaccines would you like people to take away from this episode, Dr. Fekete?
I think people should be appreciative of all the wonderful things that vaccines have done, because we tend to take them for granted now. If you talk to people of my generation or my parents' generation, they will tell you about the devastation that people had and result in the wake of measles and chickenpox and illnesses like that. And we tend to forget that now. In addition, we have vaccines like the hepatitis B vaccine that's really improved the quality of life and lives of a lot of people in this country and around the world. We now have an HPV vaccine against human papillomavirus that's reduced the rate of genital warts, but also more importantly, of genital cancers. And I think we're just beginning in the vaccine world, as you can tell by the excitement that we're generating now about a potential vaccine against the new coronavirus, COVID-19. So I think vaccines have a lot of life left in them. And despite the controversies and uncertainties, I think vaccines have clearly shown benefit to people around the world, and even in the US, where we tend to be very skeptical sometimes.
I think this latest outbreak is really telling on the fact that humans live with infectious pathogens day in, day out. We hear about them, obviously, when patients start to suffer and things go awry and people have extensive morbidity and mortality. Recognizing that also human beings are extraordinarily adaptable, and we do live with many of these viruses pretty effectively. But that doesn't mean that we should just take it easy, because it is our job to protect the human population and manage these diseases. So I'm afraid infectious diseases, despite the extraordinary accomplishments over the last century or so, these diseases continue to pose a threat for us. And therefore, as we learn about how to manage these infections, we will continue to apply our brain trust and our collaborative capabilities to do our best to stay out in front of such emerging pathogens.
Thanks for listening to ID Viewpoints. If you like the show, please be sure to rate and review us and subscribe wherever you listen to podcasts.